Hi, everyone, and welcome. I'm Jennifer Johnson, Director of Family and Community Outreach at Golisano Children's Hospital. And joining me today are two people who've been getting some national attention for the work that they are a part of here in Rochester. We're very excited about this. Dr. Kate Greenberg is an adolescent medicine specialist here at the Children's Hospital, and Dr. Andy Aligne is Director of the Halcombe Center, which we will talk about more in just a few moments, because if you don't know, you're going to need to know about this place. The national buzz I'm talking about is around your work with teenagers and LARC, LARC standing for long-acting reversible contraception. All right, so Dr. Greenberg, when we say LARC, let's start with the basics. Like, what is that? And why are they more effective than, say, like the traditional birth control that we've all heard about?
Right. Well, thanks for having us, Jennifer. I'm really excited to talk to you. When we talk about LARC methods, what we mean are the contraceptive implant and the various kinds of intrauterine device, or IUD. These are up to 40 times more effective than things like the birth control pill, the patch, or the ring. And mainly it's because they're with you all the time. The pill, the patch, the ring, other forms of birth control really require folks to remember to do something more often. And when I talk with young people about this, I really am talking about convenient birth control. It's kind of with you all the time. And that's the reason that up to 50% of doctors in a lot of studies use the contraceptive implant or the IUD. Because as female physicians, we know that these things are really, really effective and really, really convenient.
All right, so you, as doctors, have that information, those statistics that you mentioned, 40 times more effective. That's huge. But now comes the task of letting the public know about this. And that is where your work took you a really unique approach. And we say, enter the Hoekelman Center there. Dr. Aligne, can you give us a brief explanation of what that center is and the approach that you all took, this unique approach you took when it came to LARC?
Sure. Thanks for the opportunity to talk about the center and the initiative. So the center is named after Dr. Hoekelman, who was the chair of the Department of Pediatrics in the past. And so it's part of the department. And what it does is it connects doctors with nonprofits locally and globally to work on projects that improve health at a community level. And so at any given time, we've got, maybe 20 small projects going on. And sometimes these work out and are very promising, and it seems like a good idea to try to expand them and turn them into actual community implemented initiatives. And so the LARC initiative came out of an evidence-based contraception project like that, initially started by residents. And the LARC initiative built on that and on our partnerships with numerous nonprofits in town and with lots of practices of health and healthcare providers all over Monroe County. And so there's been lots of good stuff going on in town that's helped teen pregnancy rates and unintended pregnancy rates to go down. And we were able to build on that and add in the LARC initiative, and that's part of why we were so successful.
We mentioned teens though, but the approach here, as you mentioned, working with those groups, it's working with the adults, right? So you're not,
right.
Tell me how that works.
Yeah, so that's something that surprises everybody when we talk about, we did a teen pregnancy related thing and we didn't talk to teens really. Because what we knew before we started was that there was a lot of evidence in the research literature that there was a lot of misinformation and misunderstanding about these methods among doctors and nurses, and also out there in the general public. And so this was something where we thought, well, this is like a new phone or whatever that's coming out, and people ought to know about it, but they don't know about it. So let's just get the facts out there. And the research showed that when you gave people the facts, that they got excited about this and they wanted to use it also. And so what we did is we talked to adults who worked with teens, so doctors and nurses and nurse practitioners in clinics, but also we talked to people who worked in the community and after school programs and schools and different kinds of youth agencies. And the idea was that teens and adolescents often and just everybody pretty much, they get their information from people that they trust. And adolescents tend to get a lot of their information from adults that they trust. And so this way, if we were going to get the word out through the community among adults that teens go to that they trust, then the information will get to the adolescents that way.
So you guys had meetings, a lot of them over the last 6 years. I know Dr. Greenberg, that brought you to a lot of different locations. You made, after school programs, as mentioned. And the results show this is working, right?
Yeah, absolutely. Rochester's been doing a great job at working on teen pregnancy, most of which is unintended, for a very long time. So we've seen a 50% drop in teen pregnancy in the last decade. And a lot of the agencies that we partnered with in the LARC initiative were the folks really leading that work. But the really exciting data that we showed concurrently with the LARC initiative was that LARC use went up. Andy's dream when we first started talking about this was that every lunch lady and soccer coach would know about LARC, bus driver, any adult that a kid trusts and might go to and say, hey, here's a thing I'm thinking about doing. That trusted adult would have the right information. And what we've been able to see over time is that LARC use by sexually active high school students in Rochester rose from about 4% to about 24%. And nationwide and statewide, that was sort of 1% to 5%. In New York State, and went up from 2% to 5% in the US overall. So really, Rochester's seeing an extraordinary growth in access to information, to the idea that this is safe, effective, available for teens. And we're seeing young people in choosing contraception really responding to that.
And people are responding to your statistics. This was just recently written up in the American Journal of Obstetrics and Gynecology. So congratulations on that big honor. We talk about everyone, being a part of this. So Dr. Aligne, if people want to partner with your team on this and maybe host some of these informational sessions, Kate mentioned, the bus driver, the lunch lady, the soccer coach, if people are like, wait, I want to be a part of this, I want to learn more, how can they partner with you on this?
Well, right now with COVID, it's a little hard to do our lunch talks, unfortunately, because those were really great. And that was really a part of how we were able to have this effect, because we had these open two-way discussions with people over nice lunches, and that helped a lot. But we are available to do it by Zoom, and we're more than happy to do that. If people want us to talk with their organization, and all they need to do is look at the website for the LARC initiative, which is www.larc.umc.edu, or if they wanted to learn more about the Hoekelman Center in general and other kinds of community health things that we do, or how to get help connecting to community agencies, or if they're a community agency, how to connect with the medical center, they can check out www.hoekelmancenter.org. And Hoekelman is spelled Hoekelman.
Sounds like a man who has to spell it over and over again many times a day. Well, you guys, congratulations on this amazing work, and glad we can put it out there and let more people know and potentially allow them to partner with you as well. But thanks for making us proud and putting Rochester once again on the map.
Thanks
Thank
so
you,
much.
Jennifer.
Yeah,
Take care,
bye.
guys. Bye-bye.